We were able to reach about 16,300 girls out of the 41,000 that we were supposed to reach sometimes last year. Come April, we were expecting them to come for their second doses, but this was not possible because the main strategy that we were using then was school outreaches, and the schools were closed due to COVID. So the only alternative we had at this time was to call them using the contacts that we were left with during their first doses. And some of them responded and they were able to come to our facilities for their second doses. This year we have a new cohort that has graduated to 10 years, but we are yet to do the micro plan. So we are expecting to have a meeting with the teachers once the schools open, so that they can give us the new number of the girls in their schools who have graduated to 10 years, because now this will be our target for this year. We are expecting to do outreaches, school outreaches, immediately the schools open, to see if we can cover, we can be able to reach most of them. The question of delay in the second dose, because most of them were supposed to receive it in April, and the challenges came in of closing schools, and so most of them have not received their second doses. We are encouraging them to come because it's not too late. Even if they have gone 2 months, 3 months, 4 months, we will still give their second doses. So they are welcome to our health facilities for their second dose of the vaccine. We have had challenges initially with staffing, especially in level 2 and level 3. But since the introduction of universal healthcare, we've had 2 cohorts of health workers provided by the national government. The county government also employed for us about more than 300 health workers. So this has covered the shortage that has been there, and therefore we are expecting even access to improve than what it was. Although it was good, our access in Nakuru County generally is good because we use, in immunization, we use Penta-1 to measure access, because this is when a parent decides on her own, I'm taking my child to the hospital. Unlike the other 2 vaccines that we give before this Penta, where it is the health worker who initiates. In Penta-1 is the parent who decides, yes, I have to take my child to the hospital. And you have seen our performance in Penta-1, we are doing very well. We have a coverage of about 84 at the moment. Yes, so access is good in Nakuru. Last time we had a target of 41,000. Yes, and this time around we've not, like I said, we are yet to do our micro planning. This micro planning, we have to do it with the teachers, because we don't know how many girls out there have graduated to 10 years this year. So we have to link with the schools once they open. We do a micro plan. Each school will tell us how many girls they have in their school who have graduated for 10 years. So this will be our target for this year. We intend to do that immediately the schools